Good day. I'm Dr. Hannah Norton, representative of the Homeopathic Association of South Africa. And with me today is Dr. Jaci Schultz, who will be taking us through the condition attention deficit disorder or attention deficit hyperactivity disorder. Hello, Dr. Schultz. How are you today?
Excellent. Thank you, Hannah. How are you keeping?
I'm fantastic. I'm fantastic. Will you be able to take us through what exactly is the condition known as ADHD?
Absolutely, and it's quite a relevant topic for us at the moment. It is ADHD Awareness Month, and there is a misunderstanding that you have two separate conditions, ADHD and ADD, but actually the DSM criteria have changed and you only have now ADHD with or without impulsivity. So it used to be called attention deficit hyperactivity disorder and just attention deficit disorder, but that no longer exists. So either you've got a kiddie who's not concentrating, who can't keep still, or you've got a kiddie who's not concentrating, who can manage to keep still.
And what other symptoms might parents be able to identify or look out for with the condition?
A lot of the time, these kids can't finish tasks, they're easily distracted, they might be irritable, they lose their temper, they might have levels of anxiety, even possible depression.
And Dr. Schultz, it seems to be that it is a condition that predominantly affects boys more than girls. Is there any sort of thought behind why this might be the case?
Yeah, it's quite interesting because we know the data shows us that there are 3 times more boys than girls who will be affected with ADHD, but we can't find specific reasons for that. There are quite a few hypotheses. We used to think it was genetic, but that's been proven not to be true. One of the theories is that it's just a lot more difficult to pick it up in girls because it presents as a very different, complex clinical case.
And with that in mind, with this difference of appearance and manifestation in different individuals, are there any other conditions or cofactors that could be confused as being ADHD?
Absolutely. We've got kids who possibly have bipolar disorder where they are irritable, there might be a bit of aggression, they're restless, they're very talkative. Could be high functioning autism, perhaps even something like Asperger's where it's misdiagnosed. Certainly your hypoglycemic kiddies and patients who go for too long without eating a low glycemic meal, or they're consuming high glycemic refined sugared foods, so their sugars crash, and as a result they become terribly irritable and aggressive, and they just can't cope in the moment. And then of course it's almost the overlooked simple things like a kiddie can't see properly because their eyesight is poor and they can't see what the whiteboard says or the teacher's pointing to on a poster, or they can't hear, or both. And as a result, quite often those kids are kind of labeled as the troubled kids and the difficult kids. It's actually because they can't hear or see what's going on in front of them. Another one, sorry to interrupt you, is that I think very often nutrition is not looked at properly with kids, and because of that they may have nutritional deficiency, perhaps extremely low magnesium or low vitamin B, and as a result of that they don't have the nutritional capability to perform optimally.
In terms of what a homeopathic doctor would look at in assessing and dealing with a child or indeed any individual with ADHD, what would that homeopathic approach entail?
So the only real difference between a homeopathic practitioner's approach and a conventional practitioner is we all want the patient to be well, but we're going to look at it from a slightly different angle. If the patient comes in with a diagnosis, we don't only have 1 or 2 or 3 medications that are applicable for that kiddie. We have to look what is most matching for that patient from hundreds of remedies. So we spend a good hour with that patient, very often with their main parent or both parents with them, going through everything from their past medical history, the mom's pregnancy with their child, if there were any traumas, illnesses, vaccinations, even personality, temperament issues, right through into the current age they are now. And from that, we try and obtain as much information and data as possible in order to find the most specific homeopathic remedy to how that child presents. And the reason I say to the way that child presents is you can have 10 ADHD children, and each one will have a slightly different way of presenting. Some will be very loud and out there, others will be more introverted, they can't concentrate it. Some may have terrible nightmares and still perhaps wet their bed at night. Others will have a voracious appetite and constant diarrhea at the same time. So depending on how that kiddie patient presents, the homeopath will formulate the script based on that child's specific needs.
Perfect. And Dr. Schultz, you've mentioned a lot about children that are affected with ADHD, but there is definitely a rise of adults that are being diagnosed with the condition itself. Has that been your experience, and what sort of an approach would a homeopathic doctor take with an adult with ADHD?
So it is quite often that we see that, we're never sure, is it because it was never picked up when they were younger, or is it a condition perhaps they developed when they were older? But they tend to come in with, obviously, when I say the simple symptoms of poor concentration, but they also know that they can't finish a task. They're often late for their meetings or just don't arrive to their meetings. Short tempers, irritability. They could have associated anxiety, perhaps associated depression with low self-esteem, terrible organizational skills. And all of these put together, you can very fairly and clinically give them the diagnosis of ADHD.
And for those patients that are on a traditional medical approach for ADD, ADHD, like your concertas and your Ritalins, would something in the homeopathic realm be able to assist, or would there be any contraindications if they're on that treatment path?
It's absolutely 100% safe to take a homeopathic remedy in conjunction with any conventional medical approach, any medical drug. And the reason for this is homeopathic medication won't be contraindicated to a condition or a medication. But in saying that, please don't think that just because something's natural, it's safe. A herbal or botanical medication is very differently prepared to homeopathic medication, and as a result, it may be contraindicated in a health condition or a medication that child's already on. So absolutely, the parent must tell the practitioner, be it the homeopathic practitioner and or their conventional or medical doctor, exactly what they're taking.
For parents or individuals that are looking for a homeopathic practitioner or a homeopathic approach to the management of their condition, where might you be able to direct them?
So we always want to suggest that patients will contact a registered homeopathic practitioner, because we know that in South Africa, our homeopathic practitioners are very highly trained. They spend many years at university learning the diagnostic skills as well as the materia medica, which is our homeopathic MIMS. And because of that, we generally suggest that patients go look at on the website homeopathy.org.za, as they can actually search for a registered practitioner in their area who are able to assist them to get to optimal wellness.
Excellent. Thank you so much, Dr. Jaci Schultz, for your time today, and thank you, viewers. Stay tuned and please like, follow, share our social media. The details will be following this presentation, and continue on your journeys with homeopathy, the wellness profession. Thank you.